Log in with Robert Singh. I am very happy to be here and I welcome all our viewers across Facebook. Wherever you are, a special welcome is extended to you. And today we are going to talk about something on HIV, something that is very interesting, something that you know or you don't know. But let's get started. Our topic for today is prevention with positive. That's right, you heard me. Prevention with positives. In this case, it is where someone who is living with HIV and having a relationship with someone who is not living with HIV, and these two people are living together, and the person that is living with HIV is unable to infect the person who is not living with HIV. So let's get into the whole aspect of the discussion. Before we get to the meat with prevention with positive, I want us to understand some simple definition. We must understand what really is prevention and what do we mean by positive. Now, prevention is the action of stopping something from happening. It's an action. We must do something from stopping this thing from happening. And there are many examples of prevention. Let's take a very simple example. Someone who is living with HIV and having sexual intercourse is using a condom. So that condom is preventing persons from becoming infected, or the condom will block the transmission of HIV to the other person. So prevention is where you're stopping or preventing something from happening. And in the same example, someone who is not living with HIV but having a sexual activities or having sexual activity with someone and using condom in a male to female relationship, it means that condom can prevent pregnancy. So when we look at prevention, we mean that it is the action of stopping something from happening. And when we say action means that there's something that we need to do. And what about what is positive? Well, um, there are many discussion around positive and the positive in different contexts. For example, someone will say, well, Robert, you have to think positive. Oh, you have to have a positive attitude towards work. You have to be more positive and things like that. But in this case, we are not looking at positive in this direction. We are looking at positive where someone is infected with HIV. And the new term now is that we do not say that someone is positive with HIV or someone is infected with HIV. The new term that we are using is saying that someone who is living with HIV. From time to time, I will also use the old term just to refresh our memory, but let's get now more acquainted with the new term that someone who is living with HIV. In fact, it is not really a new term. It is there for many years, but we have to start introduce it into our discussion. So we now know what is prevention, the action of stopping something from happening, and positive means someone who is living with HIV. It means that there are evidence that the human immunodeficiency virus is within the person's body. So that is what we mean by positive. Now, leading up to the body of the discussion, prevention with positive, we also have to take in consideration ways of how HIV is being transmitted. And we know for now there are lots of information saturated on all the media platform, news and so on But still, some people in this modern age still believe and still convinced that HIV is being transmitted through mosquito bites, hugging, sleeping together without any sexual contact, sharing utensils. Imagine people think that if someone is living with HIV and you drink from the same cup or eat from the same plate, you can become infected. People still believe that. They are still in this doubt and are not so convinced that HIV can be transmitted otherwise. So, what are some of the ways? Vaginal and anal sex without condoms, or we can say unprotected sex, sharing drug equipment, for example, people who are using needles, and when they having certain equipment that they use, it can also transmit HIV. Sharing sex toys, mother to child transmission, and in this case during pregnancy and even after delivery or during delivery, contaminate contact with contaminated blood. So these are just some of the ways to bring us back into the discussion that HIV is being transmitted in this manner and not the previous one that I outlined with the casual contact with hugging, kissing, eating from various utensils and so on. Now we know how HIV is being transmitted, but we also have to know how we can tell when someone is living with HIV. Some people I still hear in conversation, some people are saying that, you know what, that person looks like they're living with HIV. That person looks HIV positive. That Robert looks as though that, you know, that he got the virus. Some people still use those kind of judgment and measurement to say that, yes, they look or they could tell because they know someone who is living with HIV and that person is having a relationship or had a relationship with this person, and they can come to the conclusion that person indeed is living with HIV. The person may look like he or she lost weight, but HIV is not the only infection or not the only medical condition where people loses weight. Someone who is living with diabetes too can lose weight very rapidly. Someone who is living with cancer or any other immunocompromised illnesses can make people lose weight. So the safest way how someone know their HIV status is to do an HIV test or HIV testing. And there are several tests or three tests I'm going to identify in our discussion. And one is the NAT test. The abbreviation is NAT, and this is a nucleic acid test. Now, this test is very advanced from the other two tests that I will bring to your attention shortly. This test is where they draw the blood directly from the vein, and from doing this test, you can actually confirm if the person is living with HIV. This test also can bring to our attention that they can actually say how many viruses are in the person or what we know as viral load. So that's one test that we call the nucleic acid test. The other test is an antigen test. An antigen sounds like a very big word, but it is not really a big word. It's just a word, and it's a scientific or medical word. But in simple terms, antigen means that when a foreign body enter into our body, or when something foreign enter into our immune system, that it does not belong there. So let's say I accidentally swallow a coin or a button from a shirt. That is known as an antigen, even though it's a solid matter. but it does not belong into the body because our body is not designed to have that. And similarly, when viruses and bacteria enter into our body, they're antigen, and this antigen does not belong there. And so that the body respond, the body has a very strong fighting immune system. This immune system is very alert, very up to date, especially if we are healthy and keeping our immune system healthy, is where the immune system respond to this antigen and say that you does not belong there because you are foreign matter, you are invader, you should not be in my immune system. And so the test for antigen and the specific test for HIV, that specific antigen, which is HIV, the test is going to design to test for that. And then you will have a conclusion whether it's a negative or a positive. Okay, so the other test I want to bring in our discussion is what we call an antibody test. And most people know it as a rapid test. But first, let us understand what really is antibodies, or what when someone say that, oh, that there isn't enough or there are no antibodies showing up in a test. Now, antibodies are a part of the white blood cell, or it is a type of white blood cell. And we have several white blood cells in our immune system. I would want to believe we have about 5 different white blood cells. And the main white blood cells that we are more familiar with is the monocyte, which is these blood cells are their role and function is to fight any infection. So these antibodies are part of this white blood cell group. And what it does, they also get into the fighting battle. They are soldiers, they are protector of our immune system. So when HIV enter into someone's body, this process of fighting produce what we call antibodies. And these antibodies are the first line that come in defense of our immune system, and they are the first one who rush to start fighting against the HIV. Now, in all the process of this battle, because the HIV is an antigen, it's a foreign matter, it's an infectious agent, it should not be in our immune system. So what happened when these antibodies are fighting, they found that, well, they need backup. And what they will do, they will inform the other white blood cells who will come on stream as a second backup and start the fighting to carry out this deadly battle to fight against HIV. So in this process, when these antibodies are produced, then a test is done to see if they are antibodies specifically to HIV. So we can't have, let's say that we can't have malaria or chikungunya or COVID, and we use one test to say that, okay, we are going to get the result for HIV. No, HIV has its specific antigen that you have to use during the test so that you're only checking for HIV antibodies. In fact, any viruses or bacteria enter into our immune system, it means that they produce their own antibodies. So if someone is having syphilis or herpes, it does not produce an HIV antibodies, it produces their own antibodies. So when we are doing the testing, it means that you are testing specifically for HIV antibodies. So these are the 3 tests. The NAT test, which is nucleic acid test, the antigen test, testing to see when there are foreign invaders in the system, and we have the rapid test that we know as the antibody test. The antibody test is widely used all across the world, especially in low budget setting area, or if you need a test immediately. It can take like approximately 15 to 20 minutes, but that is just a first line test. You go on to do other tests. And at this point, we'll take a break and don't go away. We'll be right back to continue this discussion. Thank you.
Sostém e apoio do na persona HIV. Cura Plus te informa. A bota educar e sabe prevenir. Papia palavra clara, tá nos forma de comunicar com a comunidade. Para assinar abo, saco HIV tá mais com status. Serviço social tá uma necessidade para tur. PC, Cura Plus, serviço sem distinção. Mujenan Cura Plus Capapia Clá. Programa interessante para escutar pensamento de gente mue para gente mue. Por cada vez tópico diferente. Apresentar para dama não voluntário de Cura Plus. Tour de 2 de luna de 7 horas para 8 horas da noite, riba a plataforma de Facebook, com sua repetição riba YouTube. Mujenan Cura Plus Capapia Clá. Pa abo como gente mue que tá bom informar. Cura Plus tá informar. Apresentado por Deutli Ferdinandes, HIV/AIDS Counselor. Programa que tá para abrir tocante HIV e maleza não transmitir sexualmente. Programa com roupa informação para botar mais saber qual era. Tour de aluna para 7 horas da noite, riba Facebook, com repetição riba YouTube. O programa aqui está uma produção de Cura Plus em cooperação com Radio e TV Positivo Curaçao. Cura Plus está informar e educar sem distinção. Sostém e apoio do na persona HIV. Cura Plus te informa. A bota educar e sabe prevenir. Papia palavra clara, tá nos forma de comunicar com a comunidade. Para assinar abo, saco HIV tá mais com status. Serviço social tá uma necessidade para tur. PC, Cura Plus, serviço sem distinção.
welcome back, Bong Bini. And for those who are now joining us, I want to say a special welcome to you. And for those who are still with us, I thank you for investing your time with Kura Plus so that you can have some very relevant information and you can have the correct information that is going to dispel all the myths that is out there. So welcome back. For those who are now joining us, our topic for today is prevention with positive, and we have covered some definition: what is prevention, what is positive. We also talk about type of HIV test. We talk about modes of transmission of HIV, and all these discussion, our conversation, are leading up to the point where we are going to meet with the meat of the conversation, prevention with positive. Now, I want to highlight or reflect a little bit on methods of prevention of HIV transmission. So, anytime we are having a discussion about HIV, it is important we say how HIV is being transmitted, and then we also have to do the counterpart to say how we can prevent the transmission of HIV. So I'm just going to highlight some of the ways briefly how we can prevent transmission of HIV. And remember, HIV is a human immunodeficiency virus. Now, one of the ways, or the universal way that, and the most quick and effective way is using condoms with lube every time. Using condoms with lube every time you have sex. You use a condom correctly and consistently. And why is it you have to use condoms with lube? It is important to have condoms because condoms act as a lubricant to lubricate the part where the penetration is going to happen. And if that part, whether if it's the anal sex or vaginal sex, that area is not lubricated and it kind of dry, it means when the penetration is happening, that rubbing of friction between the two areas can cause the condom to break, or some people will say to burst. And we know if a condom is break or burst is that it is a very high risk for transmission of HIV. So one of the best ways, or one of the many ways, is to use condom with lubes correctly and consistently. And there are several articles or many things on the social media platform to say how you can use a condom correctly. Choose sexual partner wisely, and some people will say, well, they should be able to have sex with any and everyone who they like, and if the two persons agree. That is true, but we also have to choose our sexual partner wisely. We can, it is not so good to choose someone who may have several partners. It can put someone at risk. Some persons even go as far as possible to have their partner be tested before they go to the stage of having any penetrative sex. Some people even go even further to say that they do one test past the window period and they do another test just to ensure, even though they're planning to use condom in their sexual encounter. So some people take a very lot of precautions. Some people don't take all the precaution, but it is important you choose your partner wisely. And if you feel that you want to go on to do tests with your partner, you call it partner testing, it is good also. Test for HIV and STI regularly. You always be up to date with your HIV testing. Some people come every 3 months, some people do it every 6 months. Some people do their STI testing once a year, some people do it twice a year. And if you do it regularly, you can know your status both in HIV and STI, because HIV is also an STI, but like we like to pay more attention on HIV, though it's an STI. We like to pay more attention to it separately. And by the way, in this discussion, if you have any question, if you have any question whatsoever, you send them to us. We will answer them. We have a very competent administrator and we have a very competent technician who can get all these questions to us. If you need to send them in Papiamento, we also can answer them and we can give you both versions. So any question you have, any doubts you have concerning our discussion, or any question around HIV, please feel free to send us them and we can get the answer to you. So the other methods of prevention of HIV transmission: do not share needles. Only use sterilized needles. And someone asked me that if you are giving persons sterilized needle, it means that you are promoting person for continuing misusing drugs. That is true, but if you look at the situation carefully, you are also preventing the person from becoming HIV, or becoming, for the person to living with HIV. It means that if the person now has both, the person is hooked on drug and now living with HIV, you have a double whammy. It's a more compound challenge. So you at least prevent one, which is HIV, by sterilized needle, and do not share your needles. So these are some of the method of prevention of HIV transmission, so that it can come to us and refresh us that these are things we can do to prevent transmission of HIV. And then we come to this other key point in the discussion, and we are getting very close to the biggest key point that we wanted to bring home to the discussion, that is prevention with positive. Someone who is living with HIV is having a relationship with someone who is not living with HIV, and they are now going to have sex without condoms, and if it's a man to woman relationship and they want to start a family, they can also have children and the children can born without HIV. So this is the meat of our discussion, and this whole discussion is built on effective HIV treatment. So when someone is living with HIV, it means that they go on treatment that we call the antiretroviral therapy. It is the ARV. Some people say, sorry, it is the ART. Some people say ARV, but we say ART because it's a therapy and because the medication consists of 3 and more different kinds of medication combined together, and that makes it a therapy. But if it's a ARV, it means that there are up to 2 combinations. So the ARV, ART, they use interchangeably, but we will stick with the ART because the ART is the therapy. It's a combination of 3 or more medication in one tablet. So the effective treatment reduce the amount of HIV in someone's body. And when it reduces the virus in the body or the viral load, it comes to a point where you have your viral load is so low. It is so low. It means that the standard testing cannot detect the virus in your body. And that is why we use the term undetectable, or in the more medical terms is where you virologically suppress. And at this point in time, it is where you have U equal U. U mean it is undetectable, and the other U is untransmittable. And that's a worldwide campaign a few years ago where U equal U, where your viral load is so low, it between 20 to 50 copies, that the standard testing cannot pick it up. It's so low that it becomes undetectable. The machine cannot pick it up. And at this point where you're having sex without condom, you cannot, you cannot transmit HIV. It is not Plus is saying that, it is not Robert is saying that, it is the science out there. It is being endorsed by the World Health Organization. And all these organizations that work with HIV, it is at that point you cannot transmit HIV to someone else. It is important to note some people believe, who do not have the correct information, that when you are undetectable, it means that you are cured of HIV. Some people believe that. But no, that is a myth. That is not true. It means that you still have the human immunodeficiency virus in your body, in your system, but it is so low that you are unable, the machine is unable to detect it. But that does not mean that you're cured of HIV. And some people believe when they are undetectable at this point in time, it means that they are undetectable forever. And that is one of the misconception we need to correct, because you are not undetectable right away. When you start the medication, you are some most people becomes undetectable within 3 to 6 months, that short period of time. While some people may take a year, some people may go on longer, some people may not have, the medication may not be working with them in this effective way. So the doctors will try different medication to see which one is actually working the best way on the patient. But at that point, you are undetectable. You are not staying undetectable forever. You have to do many things. The person who are taking the treatment need to do many things to be undetectable constantly. And some of the things that you need to do, you need to adhere to your medication. You need to stick to your medication, and you need to be tested at least 2 or more times to come to the point to say that, yes, I am now undetectable. It is not the first instance you say you're undetectable and you tell everyone, okay, you're undetectable now, and you go back into your old ways. No, 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 no. You must be able to have 100% adherence. And 100% adherence means that you take your medication on time. If say 6 in the morning or 9 in the morning, whatever time, it must be directly on that time. You do not use alcohol. You do not have unprotected sex with someone else you do not know of their status, because you can also be infected with an STI. So there are a number of things that you need to do to stay undetectable. There are some false guidance giving people that doctors are saying, oh yes, well now you're undetectable, you can go and do as you please. No, it doesn't work like that. There must be some amount of counseling and guidance to hold that person, to keep that person on track. Because soon as you make a few mistakes, like not adhering or using alcohol or having or come in contact with an STI or being infected with an STI, your viral load started to rise and your CD4 started to go down, meaning that you are not undetectable anymore. But let's talk a little bit of this viral load. Let's explore what we mean by virus and viral load. In the beginning of the infection, when someone now infected with HIV or now living with HIV, the viral load usually be very high. Sometimes it can be in several millions. And there is a formula how you can calculate how the viral load keep how the virus keep copying into the body and bring the viral load to several millions per milliliter of blood. Now, at this point in time, because the viral load is so high, it means that the HIV transmission is easier because you have a very high viral load. HIV is being transmitted easier in the face of unprotected sex. Now, during the earlier part of the infection, and let's say like approximately 3 to 6 months go on, the viral load usually drops from several millions, maybe to 50,000 copies. So you have several millions, and as you in the earliest stage of the infection, and as the infection goes on, the viral load usually drops, and it can drop to 50,000 copies. But even at this time, with the approximately 50,000 copies, you are still at risk, or you can still pass on HIV to someone. It is not, did not clear yet from from all the from all the risk. You can still pass on. Now, coming back to the treatment, when you start the treatment, the viral load within the 3 to 6 months, the viral load will go down, and as I said earlier, to 20 to 50 copies. Now, at this time, someone who want to have sex without condom can go ahead, because the viral load is low. It means that you cannot transmit HIV. We come back to the U equal U. And we need to tell it is that U equal U. It is the science behind that. And these experiments were carried out for many, many years to come to the point, because people are still afraid. People still do not convince that U equal U. They said no, this thing is not for real. That they are scared, that some people still want to use condom. That's okay, but you have to think about it. You have to process it. You have to ask all the questions, seek the right answer, and you come to the point of accepting that indeed you equal you. I myself in the beginning was asking, is this thing for real? How can you equal you? And at some point, one or two of the viruses can just go over to the negative person. No, the science is saying that is you equal you. And what does this mean for persons who are living with HIV? It means a lot. And you may not know, I may not know completely how someone is living with HIV. It is a very burdensome thing. It is a very burdensome experience when people tell you what they're going through. And we still have the big devil, the stigma and discrimination to contend with. So people who are living with HIV and they now have you equal you, it's a big relief. It's a big psychological relief. It's a mind ease, because now people don't have to say, I'm wondering to know if I'm having sex with my my partner who is not living with HIV. Am I going to infect him or her? That does not be there anymore, because it's quite a relief that now people can have sex without condoms and without passing on HIV. It also a big it's a big relief, and it also a big step for persons who are living with HIV. If both partners, in this case, uh, a male to female person, where maybe the male is living with HIV and the female is not living, she's not living with HIV, or vice versa. Maybe the woman is living with HIV and the man is not living with HIV. And now they can go ahead and start a family. They can have a child, and the child can born without HIV, because you equal you. So for them, for persons who are living with HIV, it is a very big news, good news for those people. And it can also be like if both partners, in this case a male and female couple, if both partners are living with HIV and both of them come to the status of you equal you, both of them, they can go ahead and have a child, because the HIV is not found in the sperm. HIV is not found in the egg of the woman. So when the sperm and the egg meet, it's both negative a sperm without HIV and an egg without HIV, because HIV is only found in blood and certain body fluids, but not in the sperm and not in the egg. So it's very good news. What some people are doing, especially the female, she is waiting. They are, even though that they come to the point of you equal you, some people are still using condoms because they want to be extra precautionary. And that is okay if they feel that way. But persons who want to have children or want to start having a child, what some women do, they they use condoms with their sexual encounter, but for to have children or to get pregnant, they wait at the point of ovulation. And at that point of ovulation, it means that they would not be using condoms so that they can get pregnant. Now, what is ovulation? Ovulation is a stage where the eggs are released from the ovary of the woman. It comes down to the fallopian tube to meet the sperm of the man to be fertilized. And when it fertilizes, conception takes place, and then is where the woman know that she's pregnant after so many weeks. So some people do that, even though that they are in the case of you equal you. Now there are some other concerns about you equal you, and we know that when someone is on the treatment and come to the point of you equal you, that's undetectable equal to untransmittable, it means that you cannot pass on HIV. But this treatment does not protect you from STI. This your ART does not protect you from STI, and especially if you're using condoms. Condoms will not protect you from genital warts, herpes, or syphilis, because we know these STI are being transmitted by skin to skin contact. So even though you're you equal you and you contracted an STI, and you're still being adhere to your medication, you're taking it on time, you're eating healthy, you're not using alcohol, you're eating a balanced diet, you're thinking positively, that is also important. Not for persons alone who are living with HIV, for everyone. Generally, even though you're doing all of these things and you contract an STI, your viral load will still remains undetectable, even though you contracted an STI. On the opposite side, if you're undetectable and not using your medication or your ART, the antiretroviral therapy, you contracted an STI, you're not using your medication on time, you're taking it when you feel like, you're drinking alcohol with the medication, you're skipping it, you're not having enough sleep, it means that your viral load your, will go up and your CD4 will come down. And the STI is going to help to increase your viral load because you're not taking the medication on time how you're supposed to take it. But if you're taking the medication on time and doing all the right thing and you contract an STI, your viral load will still remain undetectable. At this point, we'll take a short break before we wrap up on the final segment. Don't go away, stay with us.
Sostém e apoio do na persona HIV. Cura Plus te informa. A bota educar e sabe prevenir. Papia palavra clara, tá nos forma de comunicar com a comunidade. Para assinar abo, saco HIV tá mais constates. Serviço social tá uma necessidade para tur. Pensei, Cura Plus, serviço sem distinção. Plus está informar. Apresentado por Ferdinandes, HIV/AIDS Counselor. Programa que está para abrir tocante HIV e maleza não transmitir sexualmente. Programa que rouba informação para botar mais saber qual era. Turja Luna, para 7 da noite, riba Facebook, com repetição riba YouTube. O programa aqui está uma produção de Cura Plus em cooperação com Radio e TV Positivo Curaçao. Cura Plus te informa. Informar e educar sem distinção.
Welcome back with Logging with me, Robert Singh, and we are in our final segment of our discussion. And remember, the topic is prevention with positive, and we went through the discussion to tell you that when a person come to the point of you equal you, they can prevent someone from having HIV. So that's the whole point of prevention with positive. Now, I want to reflect a little bit on alcohol, drinking of alcohol, and HIV, and especially when someone at the point of you equal you. Generally, we should generally I say no to alcohol. No to alcohol for persons living with HIV and persons not living with HIV. But if we look at adherence for persons living with HIV in terms of adherence have several points. One, take your medication on time, and when we say on time, mean on time at the same minute. It should not be away from the minute. Two, eat healthy, which is diet and exercise. Three, do not be involved in unprotected sex. Four, do not use drugs and alcohol. So we see in the adherence that there is a part that said do not use drugs and alcohol. But I know there are many healthcare workers, including doctors, are telling persons living with HIV, as long you meet at this point, you equal you. Yes, go ahead and have a beer. Go ahead and have some fun. You denying yourself for too long. What is wrong for having some alcohol? Enjoy yourself, celebrate. But we have to come back to the adherence. Do not use drugs and alcohol. So when can someone use alcohol if they're living with HIV? I would say that they should not use alcohol at all. And one may ask why they must not use alcohol. Why? And we have seen from the research, many research, the social reason and the medical reason for not using alcohol when someone is living with HIV. Now, I want to reflect a little about on two scenarios or maybe one with reference to alcohol. I know someone who was driving under the influence of alcohol. And he is telling me that, look, I can take this turn before this car meet in his pathway. Because what happened there, the alcohol impair his judgment. Alcohol has a way of manipulating the judgment in the brain, and it tamper with our central nervous system. It means that we cannot think straight. And another example is that I saw a man on a balcony. He is under the influence of alcohol. And someone come to him and he said, no, 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 I'm not coming down. I'm going to jump from the balcony. And the balcony is quite high. So you see right away the judgment that he has under the influence of alcohol. It is not the same judgment he would be having when he's not under the influence of alcohol. And when he, in his sober mind, he went ahead and jumped and injured his foot. When he, in his sober mind, he said that, did I do that? What was I thinking? You are thinking what you are thinking the way when you are under the influence of alcohol. And these are any other drugs that have an effect on our brain and our mind. It is not coherent. It causes an imbalance with the hormones in the brain, and it is the reasoning go haywire. So those are reasons why we should not use alcohol. Coming closer to HIV, now you are telling person that they must take their meds on time. But when you drink alcohol, you are saying, look, did I take my medication or I take it? Because you do not remember. You do not remember, so it interferes with your adherence. Also, you're saying that, look, I'm not going to have unprotected sex. This condom, patient tell me in my work of practice, they said, Robert, I had some drinks in my head and I was saying that the condom is taking too long to go on. Let's do it wrong. And that is where the person put themselves at risk. Further than that, what alcohol does, alcohol, when you consume alcohol, it has to be processed by the liver. And some people drinking alcohol, it creates what you call the fatty liver. It builds up the fat and the cholesterol in the liver because the alcohol caused that process. Now, the medication, the ART that someone is taking, the most of the medication are over 1,000 milligrams a day. So if you have a combination of three medication, you might have one have 500 milligrams, another one like have 250 milligrams, and then you might have another one with another 500 milligrams. But most of the medication are over 1,000 milligram a day. Now you are taking 1,000 milligram a day, that is already enough burden on the liver. And we know that the liver is the filter house of the body. The liver performs more than 500 functions every day in our immune system to keep us healthy and alive. And when the liver now is burdened with the medication, because the liver have to the liver have to synthesize it, they have to break it down and release it into the bloodstream. It is already a pressure on the liver. And now adding alcohol, which is an increased pressure on the liver, and where it burdens the liver, it changes the function of the liver, the composition of the liver, and it comes to a point where you have liver toxicity. The liver toxicity is where the liver becomes toxic. It becomes it becomes poisonous. That is why persons who are living with HIV every 6 months, at least every 6 months, or a year, persons have to do the liver function test so that the doctor can see what is happening with the patient liver. And in this case, a person who is living with HIV. So if you have one liver that is going to work for your medication, why you are burdening your liver with alcohol when you can simply avoid the alcohol? And there are more reasons, more and more findings are coming out how HIV medication is interacting with the liver and causing serious harm in the liver. And if the liver start to lose its enzymes, it means that our liver is not functioning well, and it means that we would not be able to take the medication continuously. In fact, it start to impair or interfere with our healthy living lifestyle. And someone living with HIV also living a healthy lifestyle, not because they're living with HIV, they're not healthy. They are healthy. But if you start to lose the function and the healthiness of the liver, that is going to happen. Some people say, look, the doctor tell me I can do it, and I can do it. And when 3 years down the line, that medication is not working. They, they get what you call drug resistance because the liver is not able to process the medication. So my guidance to you, you have the overall choice. But I know I have seen people who fail on their medication. It is because the combination of alcohol and ART don't go hand in hand. You take the ordinary multivitamins, it can toxic the liver, much less alcohol. So that is my understanding of how alcohol do not work with ART, especially with someone living with HIV. So in wrapping up, as I said, if you have any question, any burning question in our discussion today, all you need to do, send your question. We have a competent team who can able to give you the information. So at least you have the correct version of the information and you can make informed choices. So in wrapping up, I just want to say that our discussion today was prevention with positive, and for all those persons who did have some doubts in their mind that persons who are living with HIV, that they can always infect someone who is not living with HIV, because once you have HIV, you always have HIV, which is true, but the viral load makes the difference. So now we can change our thinking that even persons living with HIV can have sexual healthy intercourse without condoms, and mothers, women can go on to be mothers and can have children with all the discussion that we went through. And I want to ask one question. I want to leave one question with you. And you can always drop your comments. What do you think about it? What we should do, what should happen with persons who are living with HIV? What should happen with them? Should they have the same rights as someone who are not living with HIV? Should we take all the persons who are living with HIV and put them in a separate place on the island? Let's say separate them from society so that they will not come in contact with the general population. What do you think should happen with those persons, all the persons in our country here that is living with HIV? That is my question to you. Drop your thoughts on it, and let's see how you are thinking about persons living with HIV. And at this point in time, I want to thank you for investing your time with us. It was a pleasure being here with you to to provide some lights on this very important topic. I hope you enjoyed the discussion. Send your question and we can answer them. Until next time, for logging with Robert, have a very good day.
Sostém e apoio do na persona HIV. Cura Plus te informa. Abota educar e sabe prevenir. Papia palavra clara, tá nos forma de comunicar com a comunidade. Para assinar abo, saco HIV tá mais constates. Serviço social tá uma necessidade para tur. PC, Cura Plus, serviço sem distinção.